Tell us about your work as a hematopathologist.
A hematopathologist specializes in the pathologies and diagnosis of hematopathology or hematopoietic diseases, which are diseases that relate to the lymph nodes, the bone marrow, and the blood. Sometimes we also look at cases that involve the spleen and the thymus, but overall, from anything that is related to red blood cells like anemia, through malignancies that are associated with the hematopoietic system, a hematopathologist is responsible for making those diagnoses.
What makes your work so unique?
Our work as a hematopathologist is very unique in the sense that we are responsible for putting together lots of pieces of the puzzle that is a patient's hematopoietic system. Not only do we look at peripheral blood smears, we also look at bone marrow biopsies that come in a variety of ways. We have aspirate smears and bone core biopsies. We also look at flow cytometry data. We look at hematology data from the hematology lab as well. And so in many ways, it's unique since it really straddles both anatomic pathology and clinical pathology and molecular pathology, and all of those are put together to create a comprehensive final report.
Can you share your thoughts on education and outreach?
I think that being a pathologist and being an educator goes hand in hand. I think that not only are we responsible for providing the correct diagnosis to the patient and through our reports, kind of educating them about their disease, but also serving as a consultant to our patient-facing colleagues as well. And I think that, education is really part of what I do. I think that as specialists in hematopathology, I find it honestly kind of obscene that you keep knowledge to yourself. I think the only thing that knowledge needs to be, handled as is to be shared. And so education is a huge component of that. Naturally, the backbone of medical school education is pathology. I think the advocacy piece ties into that because I find that often it's lost on medical students that pathology is really the backbone of their education. And it really does come down to a lot of laboratory and pathology data that they're working with to solve their patients' problems. And I think that overall, in general, in the last couple of decades, we've really fallen into this misconception of what we do, who we are. And I think that educating not only about what we do day to day, but also kind of what we represent is important.
What was your path to pathology?
I, like many medical students, was not familiar with pathology at all. I am a foreign medical graduate. I graduated outside the United States in Pakistan, and one of our pathologists was someone who trained in the US and moved back. And I remember thinking, wow, this is an interesting thing that she trained in, and then kind of started thinking about the blood, really, which in the outside the United States, many individuals who deal with hematology disorders are actually internal medicine doctors. And so I wasn't even thinking about pathology as the person who takes care of the hematopoietic system. But I was really fortunate that during a research time during medical school and kind of a little bit after medical school, I was able to shadow pathology and pathologists and do some research associated with it. And that really did open up my eyes to, kind of what the role of a pathologist is. I completed my PhD after medical school, and even though my PhD was in lung and vascular biology, I worked a lot with pathologists and kind of histology, and that really solidified my kind of keen interest in trying to pursue this career.
What's your favorite part of your work?
I think day to day, being who I am, the favorite part of my work, I guess, is twofold. One is obviously demystifying disease for patients. I think that many times, diagnoses are considered boring or mundane, and I'm really glad that some things are common and simple and benign, and our patients are better for it. I think that the first part is providing the right answer for our patients. That I would say is number one. And very, very closely tied to it, a very close second, is sharing that information with my trainees. I think that being able to go on this journey of discovering someone's disease and really giving them an answer and doing it alone is cool, but doing it with a group of trainees that is learning with you is, I would say, even cooler.
And what's the hardest part?
The hardest part of my work is the fact that as a physician, I think about my patients often, and I don't get to see them. But that doesn't mean that I don't associate with them. I am very familiar with their names, their ages, how they've presented. Obviously, I'm very intimately acquainted with their cellular level to all of my patients, and since I think of all of my patients as human beings, obviously, as most pathologists, if not all pathologists do, the hardest part is to kind of render what are often difficult and life-threatening, very serious diagnoses, and not have the ability to kind of change what the diagnosis is and kind of go home with it, so to speak, because we're not part of the arm that will obviously give them the therapy or see them through it. That's difficult sometimes because I do carry the patients with me and think about their diagnoses. However, it's very, very rewarding to know that you've really made efforts to give them the best possible diagnosis so that they can be on the path of recovery. And obviously, without the diagnosis, that wouldn't be possible. So I think the hardest part is that as physicians, we're always taught that being a physician is actually sitting with your patient or holding your patient's hand or talking to your patients, and we don't do that, right? We're kind of behind a curtain, and so that is a little bit difficult. I think that many times when we're advocating for people to become pathologists, we talk about how amazing our field is, which is true, and we try and brush to the side the fact that we won't be seeing patients. And I think that the reality is that we won't be, apart from cytopathologists or transfusion medicine specialists. Typically, pathologists don't see their patients directly, and so I think the hard part was to make myself very happy with the way I see my patients, and for me to process the fact that what I'm doing behind the scenes is very important for their recovery.
Should pathologists have more patient contact?
I think that the jury is out, like it's split about like how people approach that question. I do think that patients are best served when they understand their disease the best, and oftentimes our patient facing colleagues can answer those questions very well. I would say that there are certain times when, if they were able to talk to their pathologists about particular cases, selectively, that would help arm them with the knowledge they need to face the journey that is going to be, coming as far as therapy is concerned or prognosis, etc. So I think that while not every diagnosis, like not every CBC requires a pathologist consultation, but I do think that there is a space and place for pathologists to meet their patients in order to answer questions or to clarify select kind of areas of diagnoses. I think that this would be in line with what I imagine to be excellence in patient care.
What one key thing would you like to share about what you do?
So one thing I would say to any aspiring medical laboratory scientist, laboratory professional, medical student, or pathologist is that diagnostics is an amazing world. And we are constantly there, figuring things out for our patients and working together. So what I would recommend highly is to shadow a pathologist, shadow a medical laboratory scientist, spend time in the laboratory, because I think that that time is not wasted, even if you don't want to become a laboratory professional or a pathologist type of physician. That time will only make you a better healthcare provider, healthcare practitioner, physician, whatever you decide to be. Being able to understand what happens in the diagnostic laboratories is only going to help you do a better job for your patients.